Hello everyone. Communication is a tool which is essential to our existence. And with our small but precious Biggish Boy community, we would like to be more communicative so that we can share experiences and information to guide ourselves to be better parents and individuals, especially to our kids, friends and fellows who have autism. इसलिए हम आपके लिए लाए हैं एक बहुत ही इंफॉर्मेटिव एंड इंसाइसिव पॉडकास्ट जिसमें हम समझेंगे ऑटिज्म की छोटी बड़ी बातों के बारे में थ्रू पीपल हु हैव ऑटिज्म, पेरेंट्स विद किड्स विद ऑटिज्म, डॉक्टर्स, थेरेपिस्ट, एजुकेटर्स एंड मेनी मोर। आइए तो स्टार्ट करते हैं हमारा बिगिश बॉय पॉडकास्ट। Let's welcome Dr. Rachana Dubey, who is a child neurologist and has been working in this field since last 20 years. Before starting this, I would like to tell about Doctor that she's one and only neurologist in Summer's life who has played a very important role in his improvement. And since we started this Biggish Boy journey, we always wanted to have her on board and talk about autism and neurodiversity. So good to have you here, ma'am. And let's talk about your journey. How did you start with neurodiversity?
Thank you for having me here. It's immense pleasure to talk about autism and neurodiversity. It has been my field of interest since very beginning. And as far as I can recall, last year of my pediatric training, which was like 1999, which is like really, really long back. And we used to have in our institute a rare disorder clinic. So you can imagine autism kids will be seen in a rare disorder clinic. That means they'll be visiting once in a while. And fortunately in that institute, we would have kind of an appointment system. Otherwise, most of the medical institutes are so busy that you don't come to know who's coming when. So we had one girl, I would not name her here, though I still remember. She was the first autism child I had come across. And they were so different, and I should say different. We never felt like, that disability even on that day. Okay. So we could feel that they're so different. So everyone in our team would be so curious when she would be visiting. So one person will be talking to her and others will be listening. And we'll be waiting when she's coming next. Because we felt like, she was so different, the way she connected, the way she perceived, her environment around. So I should say that was my first click. And 1999 and over the decades, we started seeing so many of them. And COVID pandemic unfolded really the whole hidden box, I should say. So we already had a burden of underdiagnosed cases and COVID really pushing children who were kind of borderline into a full-fledged spectrum. We all are aware of it. So I should say it's been quite a few decades and I've been seeing children with autism. When it comes to neurodiversity, I should say it's kind of, a little track back from autism because in 1990 when people started feeling a little bit of stigma about autism and to talk about spectrum, this is when to give kind of a cover to the people they started using this term neurodiversity. And by that they meant not everyone's brain functions the same, right? So rather than you calling a disorder, call it different or diverse, right? Okay. So autism is not the only thing which is part of neurodiversity. So even children who have learning disability, children who have ADHD and autism, these are the three, subgroups which are covered under neurodiversity umbrella. And so to say, it gives kind of bonding, it gives kind of representation to this community. And 1990 onwards, this has been a topic, really. I should say a movement where people who are serving for children who are autism spectrum or specific learning disability or ADHD have been served under this umbrella. Okay. So this is what is neurodiversity. I should say when we deal with individual patient, we don't want to use neurodiverse term, right? Okay. We want to address them what they have.
What they have.
Yes, right. Exactly. And we want a clarity. We don't want a merger, right? But when it comes to society, when it comes to school, when it comes to, handling them as a differently able community, then putting them together helps. Right?
Okay, right.
Because obviously the number matters, and since they have similar issues, right? So when it comes to like, policy, when it comes to how do we support them, having this term neurodiversity has given them a lot of empowerment, I should say, right? So yeah, but how much it means to an individual family or individual child, I will refrain on that. And these days you may find like, teenagers and younger adults who may say, I behave like this because I'm neurodiverse,
Yes.
right?
Yeah.
So it may go on the other side where people who are on the milder side may take advantage out of it, right? So which becomes another extreme, right? So you have people who really need help, right? And you may have people who are taking advantage out of this terminology, right? So there's a very fine line, right? And at least, it gives a society a thought over, like, as physically we are differently abled, mentally also we are differently abled, right? So person A and person B may take different, like, receptiveness from their environment, and then the way they react could also be different. So this is the idea what neurodiversity movement was all about. When it comes to autism, of course, it's a bigger and bigger subgroup these days.
Yeah. So in general, अगर हम अपने parents को या viewers को बताना चाहें कि what is autism, so how will you define that?
This is very, very important. I guess the first and foremost and the beginning that हम कैसे sensitize करें, कैसे जानें और autism है क्या exactly. ज़्यादातर पेरेंट्स और लोग ज़्यादा फिज़िकल बीमारियां जो होती हैं, बॉडीली बीमारियां होती हैं, उनके बारे में ज़्यादा जानकारी रखते हैं. उनके डायग्नोसिस भी क्लियर कट होते हैं. उनके लिए कोई ना कोई टेस्ट होता है और हम उन्हें बिल्कुल क्लियरली बता पाते हैं कि आपको ये बीमारी है या नहीं है. सो ऑटिज़म स्पेक्ट्रम डिसऑर्डर, ऑटिज़म स्पेक्ट्रम, ये उस तरह का बीमारी नहीं है जिसमें कि हम क्लियरली कोई टेस्ट करें और आपको बोलें कि आपको ये बीमारी है. तो इस तरह की बीमारियां जैसे कि ADHD, लर्निंग डिसेबिलिटी एंड ऑटिज़म स्पेक्ट्रम डिसऑर्डर, इनके लिए DSM-5 क्राइटेरिया होता है जिसमें डिफरेंट टूल्स के थ्रू जो केयर प्रोवाइडर्स हैं, who can be a psychologist, who can be a clinician, वो pediatrician हो सकते हैं, child specialist हो सकते हैं, neurologist हो सकते हैं या डेवलपमेंटल पीडियाट्रिशियन हो सकते हैं. ये सभी ट्रेंड होते हैं कि वो टूल्स और बैटरीज को यूज़ करके बच्चे को ऑब्जर्व करके वो देख पाएँ कि इसमें क्या क्या वो कमियां हैं कम्युनिकेशंस में, वर्बल स्किल्स में, चीज़ों को परसीव करने में, रिसेप्टिव लैंग्वेज में, और क्या ये वो क्राइटेरिया में फिट होता है जो ऑटिज़म के लिए डिसाइडेड हैं या ADHD के लिए डिसाइडेड हैं या डेवलपमेंटल डिले के लिए डिसाइडेड हैं.
But this happens when parents actually come to a doctor.
Yes.
But how and why will a parent come to a doctor? से हमारे यहाँ A class cities में, even B class city में generally जब बच्चा पैदा होता है तो हम doctors के पास जाते हैं for their regular shots, for regular examinations and everything. तो एक डॉक्टर एक नॉर्मल पीडियाट्रिशियन भी बता सकता है कुछ सिम्टम्स के देख के कि I'm guessing it could be autism. I'm guessing it could be ADHD, something.
Right.
But there are a lot of parents who live in villages or in places where they don't have access to doctors that frequently they don't go and meet them. So how will, if we talk about awareness, इतनी awareness उनकी होनी पड़ेगी कि भाई इन symptoms से I should go to a doctor and let's check कि ये क्यों हो रहा है.
Right. So this is a very good question, and I must tell you that these days even government hospitals and government health workers are very, very sensitized and trained. In fact, उनके जो normal booklet हैं health care record वाले, उसमें भी डेवलपमेंट के चेकलिस्ट और माइलस्टोन्स होते हैं. और सर्टेन रेड फ्लैग्स हैं जो कि सोशल कम्युनिकेशन, जैसे आपका बच्चा आपकी बातें सुनता है, जैसे आपके इंस्ट्रक्शंस फॉलो करता है, जैसे आपको कनेक्ट करता है, लैंग्वेज डेवलपमेंट के जो डिफरेंट माइलस्टोन्स होते हैं, वो सभी उसमें चार्टेड होते हैं और उसमें रेड फ्लैग्स होते हैं. सो फॉर्चुनेटली इवन पीपल हु आर अटेंडिंग गवर्नमेंट हॉस्पिटल्स, उनके पास में वो एक्सेस होता है. और उन कार्ड में फिजिकली भी वो दिखाया होता है, इवन इफ यू कैन नॉट रीड इट. तो वो फिजिकल पिक्चर्स होते हैं कि उस एज में वो बच्चे को क्या करना चाहिए. एंड दोज आर वेरी नाइस फोल्डेड डॉक्यूमेंट्स. सो इन फैक्ट दे आर इन एक्सेस टू एवरीवन. सो मेरा कहने का मतलब ये है कि 6 मंथ्स पर, 9 मंथ्स पर, 1 ईयर पर और 18 मंथ्स पर जो लैंग्वेज कम्युनिकेशन वाले माइलस्टोन का ग्रुप होता है, वो सब हमें देखना चाहिए. क्या बच्चे ने आवाज़ निकालना शुरू किया है, कूइंग करना शुरू किया है, जो आप दिखा रहे हैं आसपास के ऑब्जेक्ट वो आपके साथ देखता है कि नहीं, रिकॉग्नाइज करता है कि नहीं. सिंपल थिंग्स, ये दे दो, ले लो, राइट, गिव एंड टेक, यहाँ से वहाँ ट्रांसफ़र हैंड्स का आपके कहने पे करता है कि नहीं, राइट. तो जहाँ तक रिसेप्टिव लैंग्वेज की बात है कि आपकी कही हुई चीज़ को कितना समझ रहा है, ये असेस करना अंडर 1 ईयर में भी काफ़ी हद तक पॉसिबल होता है. लेकिन आई एग्री कि जिस तरह की एक्सपर्टाइज ज़रूरी होती है यंगर एज में ये कमियों को जानने के लिए, वो हर कहीं नहीं होती है. लेकिन बहुत सारे मदर्स, आई मस्ट से दैट द मदर्स आर वेरी good observers and they know their child in and out, right? So this has happened practically every time, that even if I have seen a 1.5-year-old where the parents are saying कि ये नहीं करता है, हमारे तरफ नज़र मिला के अच्छे से देखता नहीं है, आई कांटेक्ट बहुत पुअर है, नाम को रिस्पॉन्ड नहीं करता है, मैं मम्मी हूँ, ये पापा हैं, इतना ही नहीं समझता है, right? So those are very strong red flags. And mothers will always come up front and they will be the ones who will say that I was noticing this since long and I've been telling other family members, but no one was listening to me. Right? So in fact, I should tell you this, that forget about care providers. Most mothers are able to sense their child's, like, small things very well. Right? So I guess it is for the other family members to listen to the mother. Right? So when it comes to development, no one can tell you better than her. And they are the ones who are most anxious. They are the ones who are watching their child always. And they are the ones who feel so bad when they feel like, that they have come to a facility where their child can be diagnosed late just because they had to convince so many people. Right? So,
and also a lot of times, you get stuck in the family and societal pressure that you generally, you keep asking him, they're like, ho jayega. Because I remember my case when Summer was just born, मतलब उसके हर milestone डिले थे, वो smile ही नहीं करता था बिल्कुल भी. So हाँ, his growth was very nice, like उसके दांत बहुत जल्दी आ गए थे मगर smile नहीं करता था. उसने walk late शुरू किया था. And when I used to tell everybody, obviously मैं और मेरे husband, तो because we are same age almost, हमको नहीं समझ में आ रहा था. We could only understand that it is delayed. And we did go to doctors जो normal checkup के लिए, but nobody noticed that. And when we used to tell our family members, they were like, हो जाएगा, कोई बात नहीं, कुछ बच्चे लेट करते हैं, कुछ बच्चे लेट करते हैं. It became so late that we actually went to doctor for his diagnosis at the age of 3. That was pretty late. That time we were in Nasik, and then when we came here and we met you, and after that we started. But if at all, I'm sure today awareness is more because cases are more. 20 years back, the cases were very less that time. So obviously I can understand that we had lack of information about it. But now I want everybody to be aware. If your milestone of your child are delayed, then you should immediately talk. If not, if your family members are not helping you, talk to your doctor and just ask a random question. So they should be doing that. So what you said is absolutely right. Generally, mothers, they know, they still get misguided.
True. And I should confess here that the problem is not only from the parental side or the family side. Problem is there from the health community side as well. So as healthcare providers, maybe a pediatrician, pediatric neurologist, we shy from the diagnosis of autism. Let's confess that.
Okay.
So आप सोच सकते हैं कि there are lakhs of children even in United States, लेकिन वहाँ पर भी एक average child जो autism diagnose होता है, वो कई बार 2 से 3 साल लेट हो जाता है. सो इनिशियली आप बोलने लगते हो थोड़ा लेट है, फिर आप बोलते हो शायद ADHD है, फिर आप बोलते हो सेंसरी प्रोसेसिंग इश्यूज है, राइट? फाइनली द चाइल्ड इज 5 years जब भी आप बोल पाते हो कि हाँ इसको ऑटिज्म
अब कंफर्म
हाँ
हुआ
जी,
है।
हाँ जी। सो इवन इन हेल्थ कम्युनिटी हम ये जो प्रॉब्लम है डिलेड डायग्नोसिस का, उसको हमारे लेवल पर भी सॉर्ट आउट करने का कोशिश कर रहे हैं। जो टूल्स हम बनाते हैं, जैसे हमें पता है कि कोई फिक्स मेडिकल टेस्ट नहीं है, ये ऑब्जर्वेशन है, राइट? और ऑब्जर्वेशन भी जहाँ पर कि हमारा बहुत सारा स्टेक इन्वॉल्व है, कि जैसे ही हम ऑटिज्म स्पेक्ट्रम डिसऑर्डर बोलते हैं, the parents get like very alerted and they are feeling kind of bad about it. But I feel like a delayed diagnosis is more of a problem. The early you diagnose it, more you can bring them out of spectrum. So there are more and more children who will be out of spectrum the early we say that okay, he has it, right? So I guess we need to improve in terms of counseling. In the beginning, when we start seeing very early symptoms, and we can tell them that okay, this child is at risk for autism, right? So we are alerted, the family is alerted, and caregivers are alerted, right? But still it gives them a comfort zone that our child can be normal after some time, right?
Yeah.
Yeah.
Yes, of course.
So rather than just waiting under an umbrella of ADHD and sensory processing for few years and making him a confirmed autism and maybe of a severe category, so that is something where we have done possibly a lot of wrong to the child, right? Just because हम अपने आप को comfort देना चाहते हैं. I do not want to say कि आपके बच्चे को autism है और आप सुनना नहीं चाहते कि आपके बच्चे को autism, right? तो दोनों अपने comfort के लिए उस बच्चे का भविष्य को हम
कई बार पेरेंट्स को पता भी चल जाता है कि ऑटिज्म है, बट एक्सेप्टेंस नहीं होता कि नहीं बोल तो रहे हैं लेकिन मुझे नहीं लगता, नहीं मुझे नहीं लगता, नहीं मेरा बच्चा तो ये सब करता है ना, नहीं मेरा बच्चा तो स्माइल करता है ना, नहीं मेरा बच्चा तो एक्टिव है ना, बट nobody wants to understand a active kid can also have symptoms of being autistic. So जब इस process में जहाँ पे वो probably family pressure, society pressure, or being shy about it, even accepting about it, what are the consequences which child has to bear?
Right. So let me give you an example over here, right? Since I am sitting on the other side and the parents are sitting on in front of me and I can see them, मैं उन्हें देख पाती हूँ कि जो autism के बच्चे के parents हैं वो कैसे सोच रहे होते हैं, उनमें एंग्जाइटी लेवल कितना होता है, कितना गिल्ट होता है, वो अपने आप को कितना ब्लेम कर रहे होते हैं. एंड देयर आर चिल्ड्रन जिनके बच्चों को सेरेब्रल पॉल्सी या दूसरा बीमारी है, वो बहुत जल्दी एक्सेप्ट कर लेते हैं कि हाँ मेरे बच्चे को प्रॉब्लम है, मुझे इस पे काम करना है. बट व्हेन इट कम्स टू ऑटिज्म इट इज़ वेरी डिफिकल्ट एट टाइम्स, राइट? सो दे मे नीड मल्टीपल पीपल, they may need multiple professionals, they may need a proper psychological concrete diagnosis before they accept. Right? But here I would like to say something, the longer they take, longer becomes their journey to make their child all right, right? So the early we can convince them that yes, these are the deficits, these are the gaps, and these are the strengths. So whatever psychological testings we do, they pick up everything. So what is good about your child, what they are very good at, and something which is weak in them, and we need to improve upon them. If everyone starts seeing through that lens, strength and weakness, then possibly a lot of stigma goes away, right? Because then you can relate it to yourself also. You have strengths and weaknesses, and everyone is working on the weaknesses, right? So that gives comfort rather than anxiety. Because anxious parents who are blaming themselves for delay or not having to come to the facility earlier, this all affects how they handle the child.
Right.
So the moment they will enter, they will start telling you, look, he's doing this, look, he's doing that, ye karo, wo karo, leke aao, and I can see so much pressure. And all the instructions are back to back. And I'll have to tell them, please calm down. Comfort yourself first, right? And let the child be comfortable in this environment. Even before you give instructions, he will start doing, he will start following. So you won't believe how much anxious faces I see, when I see children with autism, right? So at times I feel we should have some kind of criteria to check what kind of phases parents go through, especially when the child has autism, and they are actually really different when they are reacting to their children. Right?
Okay.
So this is also, I guess, something which needs to be looked at.
So, जब parents आपके पास आते हैं and somehow you have also convinced them to accept that this is a situation right now. So, how do you tell them what is the roadmap? Where should they go from there?
Whenever, like, we are trying to tell them, or suppose, like, as you said, that they have accepted the child has autism spectrum disorder, and it's very important at what age I'm doing all this, right? So if we are still in an age where they are toddlers and we are saying at risk for autism, then of course there are certain checklists like modified chat, MChat and others, which parents can do themselves, or even a certified clinical psychologist can do it. And of course that should be done whenever there is need arises for it, right? There are some children who have other developmental delay, like their understanding and other parts. And some children could have a lot of significant behavior issues and hyperactivity also along with it. So having a full and complete diagnosis in terms of autism spectrum disorder, associated hyperactivity, associated intellectual disability, cognitive delay is very, very important. Because the moment you get a complete diagnosis, in the sense, other than autism, are there anything else which is attached? That gives a lot of clarity to the therapist and other people who will be handling the child. So of course, first and foremost is complete diagnosis. If still it is at risk for autism and we feel it is something which is a borderline zone, then of course in a younger child, occupational therapy does play a lot of role, especially in the beginning, right? So this is what I would.
But one thing I just would like to interrupt. जैसे आपने बोला कि बाकी चीजें भी होती हैं, तो is it really is it mandatory that with autism something comes along like ADHD or dyslexia or being hypo, or is it necessary, or it's like no, it just happens once in a while?
Really. So like up to 40 to 50% children with autism can have ADHD. So in fact that is the biggest overlap.
Okay, yeah.
So many parents will find it much more comforting and soothing to call it ADHD rather than autism.
Okay, but
right?
it is both ways.
Yes.
It is
so if you are
both the things.
seeing ADHD, which has a lot of speech delay and communication deficit, then it is more of autism rather than ADHD, right? So in fact, this is what I was trying to tell you, that most children who were misdiagnosed or underdiagnosed, they got a diagnosis of ADHD.
ADHD, right.
And after a few years, the care providers finally got convinced that it is not ADHD, it is autism. Right?
But the characteristics of both the things, like autism and ADHD, are similar, as well as they also have different.
ADHD does not have communication and speech deficits. ADHD generally does not have intellectual disability, cognitive issues, activity of daily living related issues. They are fairly independent to begin with. So I should say, like, ADHD is a small part and fraction of ASD. But it's not the full disease, right?
Right.
So anybody who's been working in the field, they won't find it difficult, right? Unless there are certain things which are not given clearly by the parents. So at times, as I told you, that they are in denial. So when you meet a professional, you are telling them half of the things. And what a professional can notice in the office is the child is running around, not sitting at a place, not following instructions, right? So mild ADHD, right? But whatever communication deficits, knowledge gaps, if the parents have not given a full detail, then it's difficult to diagnose.
Right.
So most of our batteries are dependent on how much information you are providing us. Right? So at times things may evolve. That somebody got a diagnosis of ADHD but eventually landed up being in autism.
All right. So
we deviated from where they should go and the therapy we were discussing, right?
Right.
So yes, occupational therapy is good to start off. And of course, whenever you're starting any therapy and training, as I said, the rule is to know strengths, and weaknesses.
Okay.
And use strengths to cover up the weaknesses and train them through weaknesses,
Okay.
right? So having a good written down plan with the therapist, written down short term and long term goals,
Okay.
and what a therapist should be doing, what the mom should be doing, because they should not be possibly doing the same thing. So same classroom therapy which is done with the therapist, if mother also starts repeating it, you are entering again into a repetitive zone, which you want to avoid in your child, right?
Fine.
Right.
So eventually, when they go to a therapist, it's always better to make a plan, separate plan for parents to work on the child at home, and therapists at the therapy center, they should be doing something else.
Exactly.
And there should be a proper 1 month or 15 days plan, and that should be upgraded
Sure.
time to time, right?
It should
This
be
is what-
1 month, I should say, because it's slow when you start off. Because we are discussing again and again, there is a communication and receptive gap. So we can understand a child who's not receiving information will take time to open up or to connect. So minimum should be 1 month, but ideally in 1 month the plan should be reviewed. I should confess here that I'm not the therapist,
Right.
right? But what I'm telling you is when we work with them and when we see the children improve, this is what we follow.
Okay. And there are different kind of therapies for different severity of autism. Like if the kid is non-verbal, speech therapy also gets involved in that. Is it true?
Right.
And then occupational therapy is mandatory, and then also come this ABA therapy.
Yes, exactly.
So these all things depends on person to person rather than, or is it important for all kids with autism?
No, it's not that one plan fits all, nothing like that. Each child with autism is totally different,
Right.
right? So depending on, are they hyperactive, how is their receptive language, are they following instructions,
Okay.
and are they showing gestures, right? So that gives us an idea that whether only occupational therapy is required, or we have passed this age for occupational therapy and now special education and speech therapy and ABA should come in, or activity of daily living should come in.
All right. So we talked about therapies. अब medication का भी बहुत important role है. तो मैंने समर के केस में medication दिया and has worked very good on him for his sleeps, for his behavior, everything. बट आजकल पेरेंट्स का जनरली मैंने जो मुझे आता है रिवर्ट, दे आर वेरी अनकम्फर्टेबल यूजिंग मेडिकेशन, कि अगर वो यूज़ करेंगे तो शायद साइड इफ़ेक्ट्स हो जाएंगे, या स्लीपिंग टैबलेट्स आर नॉट गुड फॉर देम, या बच्चों को देना ही क्यों है. तो उसका क्या, मेडिकेशन का क्या रोल है, आप बताइए.
इट इज़ अ वेरी गुड क्वेश्चन. ये बहुत अच्छा सवाल है, क्योंकि और ये बहुत जायज़ है एक्चुअली. कोई भी पेरेंट्स आजकल या कभी भी अपने बच्चों को दवाएं देने से डरते हैं, एंड दे फील काइंड ऑफ रिस्पॉन्सिबल, क्योंकि वो किसी और के लिए डिसीजन ले रहे हैं, राइट? इफ़ यू हैव टू डू इट ऑन योर सेल्फ, यू आर मच मोर कम्फर्टेबल. तो क्योंकि वो अपने बच्चे के लिए डिसाइड कर रहे होते हैं, उन्हें लगता है कि जो ज़्यादातर दवाएं हाइपर एक्टिव बच्चे को दी जाती हैं या ऑटिज़म के बच्चे को दी जाती हैं, वो सब नींद के लिए होते हैं. लेट मी एक्सप्लेन यू. मैं आपको ये बताना चाहती हूँ कि जब भी हम ऑटिज़म या हाइपर एक्टिविटी में दवाएं देते हैं तो वो उनके कोमॉर्बिडिटीज़ या एक्सट्रीम बिहेवियर के लिए होती है. तो दवाएं किस किस चीज़ के लिए हैं हमारे पास? उनकी स्लीप रेगुलेट करने के लिए, क्योंकि स्लीप यदि बराबर नहीं होगी तो डे टाइम में हाइपर एक्टिविटी और लर्निंग बिहेवियर को आप इम्प्रूव नहीं रख सकते. नंबर 2, वी हैव मेडिकेशंस जो उनके बहुत एक्सट्रीम बिहेवियर, आपने देखा होगा कुछ बच्चों में बहुत ही सोशली डिस्ट्रक्टिव बिहेवियर होता है. जो थेरेपिस्ट फैमिली मेम्बर्स को उनके साथ नॉर्मल बिहेव करने ही नहीं दे सकता. सो समटाइम्स यू विल फाइंड, आपको लगेगा कि इस बच्चे के साथ में नॉर्मल बिहेव कर पाना मुश्किल है, इसको रिसेप्टिव लैंग्वेज तक ला पाना मुश्किल है, ये इंस्ट्रक्शंस फॉलो करे ऐसा नहीं लग रहा है. तो उन बच्चों में भी दवाओं की ज़रूरत होती है. एट टाइम्स इनमें गट इश्यूज हो सकते हैं, इनमें बॉडी टोन लो या हाई हो सकता है. तो इन सारी चीज़ों के लिए स्पेसिफिक दवाएं हैं जो सबके लिए इस्तेमाल नहीं होती. तो दवाएं हमेशा नीड बेस्ड होती है. जब उसकी ज़रूरत है तब तक दी जाती है, जब उसका ज़रूरत ख़त्म हो गई तो वो ख़त्म कर दी जाती है. जिस बच्चे में दवा से फ़ायदा नहीं है उसमें भी वो दवा ख़त्म हो जाती है. और पेरेंट्स से ज़्यादा जो दवा लिख रहा है वो अपने आप को रिस्पॉन्सिबल समझता है। तो किस एज में उस वेट में क्या दवा हमें दी जानी चाहिए, क्या वो FDA अप्रूव्ड है कि नहीं, जो बॉडीज ये डिसाइड करते हैं कि ये बीमारी में ये दवा दी जा सकती है कि नहीं, तभी वो दवा देते हैं। और हमेशा वो तब तक दी जाती है जब तक वो चीज़ अंडर कंट्रोल में नहीं आ पाती है। कुछ बच्चे जिनमें एक्सट्रीम बिहेवियर और स्लीप इश्यूज बहुत ज़्यादा हैं, उनको थोड़े लंबे समय के लिए भी ज़रूरत पड़ सकती है। लेकिन आई एम श्योर यदि वो थेरेपीज़ और दूसरी चीज़ें बराबर करते हैं, डेली रूटीन प्रॉपर फॉलो करते हैं, तो धीरे धीरे ये सारे दवाएं बंद हो जाती हैं।
एंड ऑल्सो दीज मेडिसिन्स आर सेफ, इजंट इट?
दीज आर सेफ। ज़्यादातर दवाएं जो यूज़ होती हैं उसमें लिवर और किडनी फंक्शन मॉनिटरिंग की कभी हमें ज़रूरत नहीं पड़ती है। कभी कोई दवा ऐसा है जिसमें हमें साइड इफ़ेक्ट मॉनिटर करने हैं तो वो आपको बताए जाते हैं। और जो डोजेस हम यूज़ करते हैं वो बहुत मिनिस्क्यूल डोजेस होते हैं, वेरी वेरी स्मॉल डोजेस। एंड ऑलवेज आपको कभी कुछ लगा है कि किसी दवा के वजह से कोई प्रॉब्लम हो रहा है या बढ़ रहा है, तो उसको फ्यू वीक्स तक वॉच करिए। डॉक्टर या क्लिनिशियन को वापस आप बताइए कि मुझे लगता है ये दवा से ऐसा हो रहा है,
राइट,
एंड हैव अ डायलॉग rather than stopping abruptly.
एग्जैक्टली।
यदि एक चीज ने उसको बराबर काम नहीं किया है तो मे बी वी नीड टू गिव समथिंग एल्स। लेकिन दवा यदि शुरू हुई है इसका मतलब ये तो है कि उसको दवा की जरूरत थी। तो ऑटिज्म के बच्चे जो हमारे पास में अंडर 2.5 years आ जाते हैं, रेयरली उनको कभी भी दवाई का जरूरत नहीं पड़ता है।
ओके।
तो जो बच्चे 2.5-3 years क्रॉस कर चुके हैं उनमें सेकेंडरी इश्यूज आने लगते हैं, क्योंकि हमने उनके प्रॉब्लम को पहले एड्रेस नहीं किया। अभी वो हाइपर एक्टिव इतने हो गए हैं कि एक जगह 5 सेकंड भी नहीं बैठते। थेरेपिस्ट को थेरेपी इनिशिएट करने में प्रॉब्लम हो रही है।
ओके,
राइट।
सो देयर द मेडिकेशन रोल प्लेज इट्स रोल। एंड इसके साथ मुझे लगता है जो पेरेंट्स हैं, मतलब दे शुड बी वेरी कंफर्टेबल बिकॉज द चाइल्ड इज विद द पेरेंट फॉर द होल डे। तो अगर आपको मेडिकेशन मिला है, और कई बार ऐसा हो जाता है, जो समर के केस में भी कई बार हुआ था कि आपने दिया कोई टैबलेट दिया उसके बॉडी वेट या उसके हिसाब से, बट उसकी वजह से वो ज्यादा सोता था या कुछ, तो आई इमीडिएटली यूज्ड टू कम टू यू कि मैम ऐसा हो गया, and used to tell me कि मिलन डोज कम कर दो उसका। तो this communication is important. That does not mean you stop it, you get scared of it कि वो बच्चे को ज़्यादा slow हो गया है मेरा बच्चा, पर्पस वही था, but ज़्यादा हो गया तो talk to your doctor. Communication is the key, I guess, here.
True.
That helps.
Because at times I have seen children who are like 7 and 8 years. For years they've been doing therapy and occupational therapy and other types as well. And still when they walk into the office, they are not sitting even for a few seconds. So sometimes literally like, we feel so bad about this, that some child who was not responding to therapy alone, जिसको therapy अकेले से फ़ायदा नहीं हो रहा था, उसमें दवाएं पहले इंट्रोड्यूस हो सकती थी, जिससे एटलीस्ट थेरेपी कुछ लेवल पे काम करने लगती।
Exactly. Right? So everything works together. Yes. At the same time, if you give medication, you do therapy, the result will be beautiful. अगर आप medication दोगे और therapy रोक दोगे तो भी वो वैसा result नहीं मिलेगा, और therapies कराते रहोगे और medication नहीं दोगे तो भी वो result नहीं मिलेगा. Exactly. In certain cases, of course.
True. And of course, I mean, as a clinician, as pediatric neurologists, we are responsible people, right? So if you ask me frankly, I'm so happy the day I say no medications. Right? So I tell them, no medications, perfect. So you've been able to do a great job. मैं therapist को भी यही बोलती हूँ कि अभी से मैं दवाई बंद कर रही हूँ, इसको बिल्कुल ज़रूरत नहीं है, and I'm so happy about it, right?
Right.
So we are waiting for medications to be stopped. But let that day reach. वो दिन आने दीजिए, right?
अपने आप decision लेके मत बंद करिए, please.
हाँ जी.
So we talked about medication also. अब आता है बहुत important जो बहुत सारे लोग बात करते हैं और आज नहीं बहुत टाइम से कर रहे हैं कि बच्चे को ग्लूटेन नहीं देना चाहिए या बच्चे को डेयरी नहीं देना चाहिए, उससे इम्प्रूवमेंट होता है. So what is the role of diet or maybe restricting diet? So what do you say about that?
When it comes to diet or nutrition, इट इज़ टोटली साइंटिफिक. जब हम बोलते हैं कि जो हम खाते हैं वो हमारे बिहेवियर में रिफ्लेक्ट करता है,
राइट.
सो टू सर्टेन एक्सटेंट हेल्दी डाइट जो एक नॉर्मल बच्चे के लिए होनी चाहिए न्यूरोटिपिकल बच्चे के लिए, जो बच्चे स्पेक्ट्रम में हैं उनको भी वो डाइटरी रूल्स फॉलो होने चाहिए। इन जनरल जो घर में बनाया हुआ खाना है उसमें प्रिजर्वेटिव्स, कलर्स, एक्सेस शुगर्स, बैड ऑयल्स, ये सारी चीज़ें नहीं होते हैं। सो सिंपली आई टेल देम टू अवॉइड पैकेज्ड फूड because you don't know what is there inside, and then it gets into excessive salt, it gets into bad fat, it also gives lot of sugars and preservatives, right? So that is the first thing which I tell them. And children who are very hyperactive, on the hyperactive side, and of course restricting sugar will help. And this is not something which one should find difficult, really. I mean, restricting sugar is not something
And
that you are depriving your
this
child
is actually
from
for
something.
everybody. I mean,
Exactly.
sugar and these things, processed food, these things are bad for anyone, any which ways, and excess of these things will eventually spoil your health.
Absolutely. So this is kind of universal. So I don't think you should be jumping out of chair जब भी मैं बोलती हूँ कि घर का ही खाना दीजिए, sugar कम दीजिए. Like it happens. Like, you know, so the parents will be like, raisins दे सकते हैं, jaggery दे सकते हैं, because they feel they are doing some kind of crime by not giving sugars to their child. I guess वो चीज़ दिमाग में नहीं होना चाहिए. खाना न्यूट्रिशन के लिए है, enjoyment के लिए बहुत सारी चीज़ें हैं. Right? True. So as long as you keep your entertainment aside, like, you know, from your meals, your nutrition, तो फिर आप उतना नहीं सोचोगे. And thankfully, I mean, this should be learned from early years. तो आप केवल ये बीमारी के लिए नहीं, बहुत सारे दूसरे बीमारी के लिए बचा रहे हो अपने बच्चे.
You should always be eating clean. What is the harm in that, actually? But I'm very happy that you did not say कि नहीं gluten बंद करना चाहिए या ये, क्योंकि बहुत लोग बोलते हैं. I mean, I hope that you don't agree with that.
I don't propagate GFCF diet, but मैं एक एग्जाम्पल देती हूँ. यदि मैं एक पेरेंट्स से मिलती हूँ जो बोलते हैं कि हम गेहूँ नहीं दे रहे हैं, हम डेयरी नहीं यूज़ कर रहे हैं, हम दूध वाले प्रोडक्ट नहीं दे रहे हैं, और हमने वो बच्चे में बहुत चेंजेस देखे हैं ये करने के बाद में, तो मैं बोलती हूँ आप कंटिन्यू कर सकते हैं.
Exactly.
राइट. सो और कोई पेरेंट यदि चाहता है कि हम ये करना चाहते हैं और हमारे लिए ये डूएबल है, हम ये कर सकते हैं. इफ़ यू आर नॉन वेजिटेरियन एंड यू फील दैट प्रोटीन इनटेक और दूसरे चीज़ सफ़र नहीं करेगा और आप ग्लूटेन फ्री, केसीन फ्री डाइट देना चाहते हैं, तो बिना डाइट कंसल्टेशन के मत करिए. न्यूट्रिशनिस्ट को आपको वो डाइट देना चाहिए. कोई भी एक्सक्लूजन डाइट बिना न्यूट्रिशनिस्ट के कंसल्टेशन के करने में बहुत फ़ायदा नहीं है, क्योंकि आप यदि उसके बेनिफिट्स लेना चाहते हैं तो उसको प्रॉपर तरीके से करना पड़ेगा. सो देयर इज़ अ साइंस बिहाइंड इट. लेकिन उसको करना एक रेगुलर इंडियन हाउस होल्ड में करना बहुत मुश्किल है.
बहुत मुश्किल है एक्चुअली.
सो आप देना शुरू कर दो, फिर उससे चीज़ें हाइड करो. राइट. फिर वो बिहेवियर प्रॉब्लम देता है कि आप दूसरे बच्चों को तो वो खाने के लिए दे रहे हो और उस बच्चे को नहीं दे रहे हो.
This is what I have not been able to understand.
So कोई डाइट इतना अच्छा नहीं है जो आप डिस्क्रिमिनेट करते रहो. और डाइट इतनी अच्छी है कि वो डिस्क्रिमिनेशन को भी कवर कर ले, ऐसा कैसे संभव है?
And then we're talking about inclusion, that these kids, you know, they are exactly same except for the brain functioning. And then we restrict them from so many things. आप रोटी खाओगे लेकिन बच्चे को नहीं दोगे, उसके भाई को दोगे या बहन को दोगे, उसको नहीं दोगे. I mean, how bad is that? So I never followed this. I mean, even I met a lot of people who said कि आप ये बंद कर दो, बहुत फायदा होता है, हमारे में हो रहा है. I never followed it in case of
I
summer.
guess, like, you know, if they have a single child, they've been able to manage, they eat the same diet. Nowadays, there are many parents who could be, like, you know, vegan and gluten free.
Yes, true.
Then it's absolutely fine, right? And if they have found benefits, absolutely fine. But if child A, right, you know, who has to be on GFCF diet, it will take minimum 3 months to notice some benefits.
Okay.
And it has to be exclusive, like, you know, GFCF diet. फिर आप करना शुरू करें, लेकिन बीच बीच में यदि आप दे रहे हैं तो वो साइंटिफिक पर्पस नहीं सर्व करता है.
Okay. Right.
So the study behind जो इसका scientific benefit है वो तभी हो सकता है जब आप बहुत strictly follow करें उसको and give it for minimum 3 months. Yes.
Okay. And then comes actually dietary supplements. How important are supplements for these kids?
Frankly speaking, when it comes to the scientific data, everything negates the use of super duper accessory supplement use. ये कहीं भी recommended नहीं है.
Okay.
So high dose vitamins, high dose DHA ये कहीं भी recommended नहीं है. जो
Okay.
भी हम इस तरह की चीज़ें इस्तेमाल करते हैं, चाहे मैं या कोई और, इसको हम कॉम्प्लीमेंट्री अल्टरनेट मेडिसिन की कैटेगरी में रखते हैं, क्योंकि ये कोई प्रूवन थेरेपी या ट्रीटमेंट नहीं है. DHA अनस्पेसिफिकली हैज़ बीन शोन कि वो थोड़ा फोकस और अटेंशन इम्प्रूव कर सकता है. सो देर आर मार्जिनल बेनिफिट्स. वो आयरन से भी होता है, क्योंकि आयरन भी ब्रेन पर काम करता है और फोकस और अटेंशन इम्प्रूव करता है. सो इफ आई सी अ चाइल्ड और मुझे लग रहा है वो आयरन डेफिशिएंट है, देन आई विल गिव आयरन.
बट दैट इज इन केस ऑफ एनीबॉडी else. आपकी किसी भी डेफिशिएंसी आपकी बॉडी में होगी, अब B12 की कमी आपको पता चलेगी तो आप दोगे, विटामिन की कमी तो दोगे,
exactly.
आयरन की होगी.
So known deficiencies you know from their nutrition and diet pattern and from their cultural habits कि इनको B12, विटामिन D, आयरन या DHA देने से फर्क होगा तो वो दिया जा सकता है.
ओके, पर ऐसा कोई प्रूवन फैक्ट नहीं है कि ये देने से इनमें इम्प्रूवमेंट आता है.
Yes, unfortunately there is no proven fact and no science behind it. No science.
Okay. That's amazing. Actually, I'm very happy because I have not followed a lot of things, and today, you kind of put a stamp on that, so I'm feeling good. Probably I did something good in Summer's life by not discriminating about diet and all, because we were foodies.
Let me tell you something. See, basically, when you do so many things, right? You follow exclusion diet. You're giving a lot of supplements. You're also giving other type of therapies and everything. Ultimately, there are 24 hours in a day.
Yeah.
So if you are doing so many things which are possibly not making any difference, you're tiring yourself. You're tiring the support system which the child needs the most. Right? So
that's nice. So I would like to talk of something very important right now, which is mental health of caregivers, like how to take care of that, how to address that, because that is very important. A person who is responsible has taken the responsibility of this child, how to take care of that person's mental health.
So you really touched my heart over here. So basically, as I was telling you earlier as well, कि जब भी मैं वो पेरेंट्स को देखती हूँ जो ऑटिज्म के बच्चे की देखभाल कर रहे होते हैं, उनकी मेंटल स्टेटस टोटली डिफरेंट होती है. उनमें एंजाइटी होती है, क्योंकि उनका बच्चा नॉर्मल होते हुए भी नॉर्मल नहीं है एज पर देम, राइट? बिकॉज वो नॉर्मल दिखता है, नॉर्मल खेलता है, फिजिकली टोटली नॉर्मल है, लेकिन उसके इंटरेक्शंस, परसेप्शंस, जैसे वो एनवायरनमेंट को रिएक्ट करता है, वो नॉर्मल नहीं है. तो उनका एंजाइटी एक तरह से अंडरस्टैंडेबल है. बट एक चीज़ मैं यहाँ पे टोटली एंडोर्स करूँगी कि जो एंग्शियस पेरेंट्स हैं वो अपने बच्चे को उतना जल्दी ठीक नहीं कर पाते हैं. सो आई रियली आई मेक श्योर दैट आई एम्पावर देम. मैं उनको बताना चाहती हूँ हमेशा कि आप ही इसे ठीक कर सकते हैं. सो मेक योर सेल्फ फाइन फर्स्ट, राइट? मेक पीस विद द डायग्नोसिस, राइट? इसका स्ट्रेंथ देखना शुरू करिए, अपने स्ट्रेंथ देखना शुरू करिए और इसको हेल्प करना शुरू करिए, राइट? जब तक वो ये चीज़ पूरे तरह से एक्सेप्ट नहीं करते हैं, तब तक वो एंजाइटी लेवल उन्हें और वो बच्चे दोनों को परेशान करता है.
राइट, ट्रू,
राइट. सो यस, आई एग्री. उनका स्लीप इम्पॉर्टेंट है, उनका रेगुलर एक्सरसाइज इम्पॉर्टेंट है, उनका न्यूट्रिशन भी इम्पॉर्टेंट है, पेरेंट्स का भी. So at times I tell them that your child is like your assistants, right? So ऐसा मत करिए कि आप पूरा काम कर लें फिर अपने बच्चे को ध्यान देंगे. आप जो भी कर रहे हैं उसमें से इन्वॉल्व करिए, right? So you are completing your daily chores and your child is helping you out, right?
And becoming independent at the same time.
Exactly. So day to day work में बच्चे का हेल्प लीजिए. जहाँ आपको लगता है कि आपके दूसरे फैमिली मेम्बर्स भी आपको हेल्प कर सकते हैं, वहाँ हेल्प और सपोर्ट लीजिए. कोई भी चीज़ ओवरडू करने की कोशिश मत करिए. एक दिन में 2 ऑक्यूपेशनल थेरेपी सेशंस, 3 ऑक्यूपेशनल थेरेपी सेशंस, running pillar to post, yes, from one therapy center to another therapy center, giving your child there, taking it back, then running to another place.
That is true. A lot of people are doing, parents are doing this.
Yes, so your transport time, right? So much of pollution you're inhaling going from one place to another, possibly traveling 10 to 15 kilometers a day. So limit the sessions, improve the quality, take home plans as well, and give yourself the lead role, right? The moment you say कि मैं कर सकती हूँ या मैं कर सकता हूँ, whosoever is the main caregiver, तो वो इतना जगह बार बार नहीं जाएंगे वो, राइट? आपको पता है कि आप भी बहुत चीजें कर सकते हैं, तो आप पूछना शुरू करेंगे कि मुझे भी क्या करना है, वो सब बताइए.
Thank you so much for coming on this platform and talking about autism and all the diagnosis and medication, everything. It was very informative. I'm sure you all must have gathered some information about autism and how to work around it. Thank you so much for watching us, our Biggish Boy podcast, and please do not forget to subscribe us and let us know in our comments that what all do you want to know, which we can include in our next session. Thank you so much. Do share this video to as many people as you can. Thank you. Bye-bye.